back, everybody. I'm here with Dr. John Kiang from Rhode Island Children's Dentistry, servicing, we just said, the south end of Rhode Island and also Worcester. You guys have a practice.
That's right. There's a practice just south of Worcester in Sutton, Mass.
Awesome. And so we're here today to talk about the kickoff of National Children's Dental Health Month. And you know, honestly, we were laughing before because it seems like there is like a week and a month and a day for everything now.
Right.
But, you know, I mean, this is important to your practice and to lots of people. So talk to us about what that is and how it came about and, you know, why it's more than just like National Donut Day, which is probably the opposite of
Sure,
National
which sounds much
it's
more fun sometimes, right?
National Donut Day is probably why there is a National Children's Dental Health Month.
That's right. So every year the ADA sponsors a month, you know, kind of raising awareness for children's oral health across the country.
Okay.
So there's different initiatives and different offices kind of partake in raising awareness for oral health for children.
Okay.
Yep. So our office is a pediatric dental office.
Okay.
That caters towards children, of course,
Mm-hmm.
and so and some special needs adults. So we
Okay.
kind of partake, but it's something that we kind of do all year long as well.
Okay. And so you guys focus on pediatric dentistry. So
Right.
why is that as opposed to, you know, adults' beautiful teeth? I mean, why the focus on pediatrics?
Well, I think it starts at an early age. I think it actually starts even you know, with pregnant mothers, kind of establishing good oral health, good habits, kind of are passed along to children, and so it's been a passion of ours at our practice to instill that kind of long-term health for kids.
Yeah.
And so, I was a general dentist for a couple of years prior to going back to do pediatric dentistry. And so my passion, as well as our all passion, is to put kids at ease, start them off early, and get them to a lifetime of good oral health.
Okay. And so talk to me about, you guys have kind of taken this month to the next level. I mean, you don't have to do anything for this month. It could just exist, and you could put a poster on the wall. But you guys kind of take it a step further. You've got all sorts of events you're doing. You're going around to schools and preschools to talk about oral hygiene. I mean, how do you have that discussion with kids, and kind of how do you go about that?
Yeah, I think it's one of those things where if you can make it fun for children and you get them engaged and you get them really excited about things, then they can kind of pretty much buy into anything. And so clearly our mission is to get them excited about basic oral health, kind of get them excited about, you know, not the most exciting thing in the world, but to brush teeth, but to get small children to be engaged in that kind of thing is something that, you know, we feel is important, something that we do all year round. So we have a mascot that goes to local daycares, and we reach out to the pediatrician's office. We go to the schools. We really kind of get kids where they are, and then kind of help them establish what they need in terms of either getting out toothbrushes, toothpaste, demonstrations, just to kind of make it fun for them so they get engaged.
So this mascot is... What's the mascot?
The mascot is Pearl.
Pearl.
It's gender neutral Pearl, and so Pearl is a very cute tooth that kind of goes around that the kids absolutely love.
Okay.
And so it's one of our great things that we have.
Okay,
to
so.
show things on. I think we got Pearl right here.
Pearl
actually.
The tooth. Pearl the tooth. Oh my gosh! Wow. So it's a real live tooth.
It's a real live tooth
that you've blown up and put a hat and a face on.
That's right.
Hello, Pearl the tooth. How are you today? I heard Pearl likes to dance.
Pearl does like to dance, and
Pearl
kind of is known to dance around the office every now and then. Kind of pops into an operatory when we see her.
I want Pearl to floss, but it doesn't look like Pearl can.
I know. Maybe not right now.
Not enough arm space.
Exactly.
For Pearl. Speaking of flossing, do you think the dance move has encouraged people to actually floss their teeth more?
You know, it at least is raising the discussion.
Was it created by dentists to
No, but I wish I was the person to get in on the ground floor on that.
Well, thank you, Pearl, for coming out.
Pearl.
It's a surprise. Don't fall on the way out. Then you'll have to go to Rhode Island Children's Dentistry if you break yourself. So Pearl that's cute. That's so cute. So kids probably are very receptive to that.
Kids are.
So for this month, she's going to go out and tour. I don't know.
She's going to go out like she normally does and reach out to see some kids. You know, it's one of those things where, you know, if kids can be comfortable in a comfortable setting, I think is extremely important. And so sometimes the dentist or the doctor's office can be a really scary event. And so if we have something that they can kind of relate to and put them at ease, I think that is one of those things that just makes our lives much easier, and it puts a positive spin and experience on going to the dentist.
And so I heard that you are incoming president of the Rhode Island Dental Association. Is that true?
Yes. So
am I not supposed to say that?
No, there's a couple of chairs, and so this year I'm the secretary of the association and the scientific chair.
Great. So you're very involved in this. This is important.
Very involved in dentistry in general, and in raising sort of awareness across the board for good oral health. So it's important.
And in Rhode Island, we have obviously some low-income families. Not everybody can afford the same things that everybody else can. I know you guys have a charitable arm. Talk to me a little bit about this kind of the stuff you're doing in that space.
Yeah. So a lot of what we do is actually based on charity work. I'm specifically involved in the Rhode Island Oral Health Foundation, which is a foundation that puts on the Mission of Mercy every year. And so the Mission of Mercy is a 2-day event once a year that provides dental services to the underserved community throughout the state of Rhode Island. So this year we partnered with Providence Community Health Center. A fantastic event. We had a very good turnout, and we're hoping to kind of continue that success. This was our 5th time that we had success.
Awesome. And so lastly, I want to kind of ask you about oral health in general. I mean, I think with my generation, it's probably started being more important. I know, like, when I was a kid, I don't think I went to the dentist as often as now I see kids doing, because I think there's just more information out there, and it's just become, more important. And so talk about the reasons for, starting your child early on good oral hygiene, and sort of really the purpose of what this month and awareness is about.
Sure. So I have a little bit of a confession to make. I absolutely hated going to the dentist as a kid. It was one of those anxiety-inducing kind of moments for me.
Had a tantrum.
Oh, 100%. I think I was probably one of the worst patients imaginable. But I think, if I was able to kind of alleviate that for kids now, I think is extremely important. And so if we can get kids in, usually the American Academy of Pediatrics says around the eruption of the first tooth or around age 1. And so sometimes the misconception is that it's too early. But it really helps kids kind of become familiar with an environment, helps get them on the path of having a discussion with parents about what they should be doing, what they should not be doing. And as long as we're setting good goals and setting good sort of anticipatory guidance for parents, it makes things just 100% better.
Awesome.
And it's also a place, too, kids are rambunctious, they run around, even those little toddlers, they fall, they hit a tooth. You just kind of need a place to go to, someone that you feel comfortable with, and to help out with that.
Do you have a good treasure chest for?
Oh, treasure chest is awesome. Got plenty of good stuff in that treasure chest.
All right. So, I mean, if anybody's watching who is a part of, a preschool or an elementary school organization, how do they get in touch with you to get Pearl out there and get these events kind of happening in their area?
Yeah, Rhode Island Children's Dentistry. You can kind of Google that, and you'll find us on the webpage. You can reach out to any one of our offices. We're located in East Greenwich, Coventry, Narragansett, and then we talked about the Sutton office.
Okay.
So if you are interested in having Pearl come out and do an educational session with your kids, she will try and floss. I don't know if she can get around that thing, but
the dance move, not the oral.
Yeah. But yeah, you could just reach out to our office and we can take care of it.
Great. So. Well, thank you so much, Dr. Kiang, for coming on and chatting with us about National Children's Dental Health Month.
Thank you.
So if you haven't made your kid's dentist appointment, do it. This is a reminder, because this is the month that we're...
This is the month that we're promoting it, but it's really, a year-long thing.
Yeah, next month is National Donut Awareness Month, so you got to clean your teeth first before you mow into those donuts. So, Dr. John, thank you so much for joining me. I appreciate it. If you want to reach out, it's rachildrensdentistry.com, and we will put that in the write-up as well. So thank you for coming out, and we'll be right back with another guest right after this. Don't go anywhere.